Namaste. Myself, Dr. Soumya Villanueva. I'm a chief consultant at Diabetes Services Clinic, Bali. So I'm over here today to talk on the topic hypoglycemia. So many patients come to us to speak about, doctor, my sugar level really went down and I started I was sweating and they had a third speech, they had a fatigue. Okay, I'll talk to that. So what exactly is hypoglycemia? What happens in your body? So there is a drop in your blood sugar level. So normally we say 70 mg per day. That is the standard average every a human should have, in spite of your diabetic or non-diabetic. So that's the first thing. Second thing is whenever your insulin drops below that, I mean your sugar level drops below that, then you will start noticing the particular symptoms. So why does that happen in your body? So what are all the positive factors? First, I'll just explain you about the symptoms, whatever happens. So that would be first thing. Most of the majorly seen symptoms are feeling dizzy or a blackout or kind of a sudden sweating. Some patients like above 50, 55, before the menopause also they have this, menopausal syndrome is what we call it. That's in them also that could be because of the hypoglycemia. So that possibility is also there. But yes, without even the sugar levels are normal, they might get the sweating. So then that could be because of the any endocrine issues as well. But yes, other than that, they can also have like literally was slurred speech. They start with the shivering of the hands. They can't fall anything. They can't eat. They can't drink, and there will be a lot of irritability sometimes, and they will not understand. They start feeling uneasy. So these are the major symptoms what we see. So what we have to do whenever you feel hypoglycemic or any of these symptoms, if at all, if you have not, you forget about your diabetic or non-diabetic, but if you start feeling the symptoms, most of the time it is related to hypoglycemic. Then immediately you have to take any maybe a glucose powder or any thing which contains the carbs. So maybe around some 3 or 5 grams, you can immediately put it below your tongue. So that is a faster absorption in your body. And if you start feeling better within 5 minutes to 10 minutes, then that's very clear that your sugar level has dropped down. That's the first aid you have to do wherever you are. The second thing you have to understand why and in which all patients this would start with. So most of the time, I have seen hypoglycemia in both type 1 and type 2. Especially those who are taking insulin, they will have those experience more often because they are not sure like how much carbs they got. They're not able to adjust that particular insulin dosage. Then also they could suffer from this. And the second thing is sometimes, especially the type of patients, what there is, they may cheat a drastic lifestyle change. It's like we start controlling their diet completely, but still they are not taking and they are not lowering their medications like diabetes medicines. Then also they often experience hypoglycemic very frequently. I mean, they won't change their medications or they won't change the dosage. They won't talk to their doctors, but they keep taking the same medicine. But they have also done many lifestyle changes. Then also they would experience those things. Other than that, I would say there are 2 more special conditions like neonatal hypoglycemia and the nocturnal hypoglycemia. Nocturnal one is like, as we say, it happens in the night. So when you are in sleep, only the people start saying it. So I happened to get up, I was completely sweating. Then your sugar level drops at the midnight. So that is like, then if that is the case, and if that is happening very frequently, then you have to visit, or if you're on insulin, then you have to be very careful when you take your night. And the second thing is, if you can have some fruits before you go to bed. So you can talk to your dietitian. We talk fruits and one. If the dry fish, the levels that are is the very good control, then you have to choose that particular thing which would help you over that. So we are into is very clear. A newborn baby, in them also there is a possibility of hypoglycemic conditions. So that is like they will also have this, hypothermia. They will not have that way. You would have seen like that we need to baby sometimes they happen to keep for the 12 month night for till the time the baby recovers, maybe 24 to 48 hours. That tends of a temporary irritation most of the time that may be taken care. That is nothing to panic. So there is a condition for hypoglycemia which exists both with diabetes and non-diabetic patients as well, but it is more common in the frequent worries of the insulin dependency. And type 2 diabetes, especially who have changed, or I mean, have really made many dietary lifestyle changes and they are not able to reduce their medications, then also they will experience. But is this a condition of being dangerous? Yes. Because every time or initially once or twice that happens in a mind, things where your body is intimating you, it is telling you that lots of time you have to take action. If not, there is a possibility they can go up to about kind of a hypoglycemic shock, we say, that they could be sudden situation as well. So that could lead to, fatal things. So that could also happen. So you have to be careful. But the chances are very less. That doesn't mean you should not be careful. So if you experience any of these symptoms, try to work on what are the positive factors. I mean, what is leading you to a hypoglycemic, and then address that as soon as possible. So this is about the condition hypoglycemia. Thank you.